Let's talk about varicose veins. Varicose veins affect 40 to 50 million Americans and hundreds of millions or billions around the planet. So what are varicose veins? I've been taking care of patients with varicose veins for the last 20 years. Varicose veins are big, dilated, ropey veins that occur mostly in the legs, the lower extremities. Varicose veins are very, very common. They run in families. They are passed down through families, unfortunately, like many inflammatory conditions. And it is an inflammatory condition. The inflammation that occurs in the body is powerful. Just think about it. I tell my patients all the time, inflammation can destroy a knee joint. It can chew through cartilage, chew through bone to the point that people's knee is bone on bone. The same can happen in your hip, the same can happen in your back, your neck, etc. So inflammation is like an inferno. It is really, really powerful and very, very destructive. Now think about a vein. I have operated on many veins. They are very, very delicate structures, very delicate. And the lining is pristine, soft and smooth. And in that lining are tiny little one-way valves, one-way check valves that should open in one direction up toward the heart and then close nice and tight. But that inflammation gobbles up and destroys those tiny little check valves. So imagine if a knee joint could be destroyed, how something that's as delicate as a butterfly wing could be destroyed through inflammation. So rather than opening and closing in a nice check valve fashion, either the valve is completely disintegrated or because of damage to the valve function, that valve opens and then flops backward with gravity, just like I always say, like a set of saloon doors in the old cowboy movies, just flopping back and forth. And when that valve flops open like that, gravity pulls the blood down into the leg, foot, and ankle area, causing tremendous pressure. And that is really the source of all of the problems with varicose veins is pressure. We call it venous hypertension. So inflammation is the inciting event, which sets up the destruction of the little valves and the damage to the lining of the veins. Again, this is generally inherited. It's also made worse by standing or sitting for prolonged periods of time. And look, let's face it, who's not standing and sitting for prolonged periods of time anymore? You can't just lie around all day. So no matter what your profession is, whether you're on your feet or sitting at a desk, you're going to be in an upright position where the right side of the heart is above your ankles. And whenever you have that, you're creating what we call hydrostatic pressure, a column of fluid that's putting pressure on those little valves also. So through genetics, you have this tendency toward inflammation if you're a varicose vein sufferer. And then on top of that, through lifestyle, sitting and standing many, many hours every day at work and on the job or at school or whatever the case may be, now you have hydrostatic pressure also pushing down on those delicate little valves. So it's no wonder that 40 to 50 million Americans are suffering from this problem. So what other risk factors are there? Well, in women, multiple pregnancies is a risk factor. Now, my father was an obstetrician and he saw many women with varicose veins, and I see them also in my practice. When the uterus expands in the pelvis as the fetus grows, it puts tremendous pressure on the deep veins of the pelvis, particularly the iliac veins and the vena cava. For any of the women out there who are watching who've been pregnant, you often will be advised by your obstetrician, especially if this starts to become a problem, to lie down on your left side, hoping that the uterus and the growing fetus will fall away from the vena cava and stop pressing on the vena cava while you sleep. Well, as the uterus expands in size, which is a miraculous process, obviously, but it's really quite dramatic. The uterus becomes so large, it pushes many other organs out of the way, the small intestine, etc. But at the same time, it's pressing on the deep veins of the pelvis. So this causes a potential outflow obstruction. So when we sit and stand, we have hydrostatic pressure that allows blood to pool in the veins and put pressure on the valves. We have this inherited inflammation that can destroy the valves. And now in pregnancy, we have tremendous pressure being put on the pelvic veins that causes an outflow obstruction of blood flow from the legs, another problem. What could be another problem? Obesity certainly is another potential problem. As we gain more and more weight in and around the abdominal area in particular, there is pressure, again, almost like being pregnancy, call it a pseudo-pregnancy, if you will, where the brown fat that you've heard about accumulates in the abdominal space, and this fat can put pressure on those deep veins also. Just the weight of the abdomen itself, especially when lying on your back for heavy patients, obese patients, morbidly obese patients, that abdominal weight can also press on the deep pelvic veins and the vena cava, causing a quote-unquote pseudo-obstruction, as if there were a blockage inside the vein, although it's not inside the vein, it's compression outside the vein. That brings us to another potential cause of what we call venous disease or venous insufficiency of the lower legs, which would be a true blockage inside the vein, which could come from a previous blood clot or a current blood clot that's still in place and existing. So you always want to look for new swelling in the leg, especially one leg more than the other. It can happen in both legs at one time, so you don't want to be fooled by that. But generally speaking, if suddenly you see one leg swell up significantly and your other leg is otherwise normal, that's a warning sign that there could be a blood clot inside the vein causing an outflow obstruction, a blockage of blood flow getting out of the legs back up to the heart. When that problem happens, you can, down the line, with time, chronically develop scarring inside of that vein. And that scar within the vein can cause a more permanent form of obstruction. We're going to talk about all of these things in my programs on health and wellness and vascular disease and circulation. I know I'm giving you a lot in this video today, but there's so much to cover. Other things that cause inflammation, like smoking and an unhealthy lifestyle, can also cause damage to the lining of the veins and lead to venous insufficiency, varicose veins, etc. So let's just touch a little bit now on the potential treatments for varicose veins. One of which that we've all heard of in the past was the old stripping operation. The stripping operation is when patients were taken to the operating room. I did this many times as a surgical resident, and under general anesthesia, the saphenous vein, which is the main culprit in the lower extremity, runs all the way from your groin to your ankle. The saphenous vein is literally pulled out of the leg with a wire device. It's almost like a straightened out coat hanger. It's a very brutal thing to do. Fortunately, it's almost never done anymore. But that was the history of varicose vein surgery, the stripping procedure in the hospital under general anesthesia. And there was a lot of blood loss, a lot of morbidity associated with it. People had a lot of pain and suffering and discomfort afterward with tremendous bruising. Oftentimes they spent 4, 5, 6 days in the hospital, and many times they were out of work for many weeks or even a few months after that procedure. Fortunately today, we have tremendous improvement in our technology, our understanding, and our ability to manage and treat venous insufficiency and varicose veins. The mainstay of those treatments are office-based, generally with local anesthesia or no anesthesia whatsoever required. This is all done with ultrasound guidance, which is an incredible technology that does not involve any kind of radiation. It is sound waves that are outside of our audible range, so we don't hear the sound, but the sound is certainly there. And the machine bounces the sound off of the tissues in the lower extremity, giving us a beautiful picture, a very high definition picture of the skin, the fatty tissue, the veins, even nerves, the muscles, the bones. It's quite miraculous. And we use that now to guide our treatment. And the treatments are typically what we call endovascular treatments, either thermal or non-thermal. Thermal meaning heat, where we use a heat source. For example, a laser, which is a single wavelength of light that can get very, very hot by attracting certain elements, whether it be red blood cells or water that are inside the vein. And there's another technology called radio frequency, which does the same thing. It heats up the vein, superheats it, and coagulates, and what I call heat shrinks that vein, sealing it shut for your body to absorb. Other veins can be injected using ultrasound guidance. So we can use the ultrasound to put a very, very fine needle or sometimes a little catheter, like a very thin drinking straw inside of the vein to administer medication. There are several different medications, the most popular of which is a sort of detergent now, kind of like soap suds. You may hear it called foam. I like to think of it as soap suds that we create to cause a medicinal or chemical burn to the lining of the vein when the vein is smaller and not so large and heat isn't required. So we can do the soap sud injection, what we call ultrasound guided foam sclerotherapy. And then we can do something called microflebectomy. It's not a stripping, but it's for larger bulging veins where under local anesthetic in the office, we numb up those areas, make some very, very tiny, very, very cosmetic pinpoint incisions, and using a specialized little instrument called a vein hook, we can grasp those little veins and pull them right out very safely here in the office with patients wide awake, very comfortable, and they can walk out of the office on their own, drive home, and maintain essentially all their normal activities. And I would say, finally, the last of the sort of big four procedures that we do is what we call visual sclerotherapy. And that's done to treat what we call spider veins or telangiectasia, these tiny little thread veins that you'll see. And they can be blue or green or red, all different colors, all different patterns. They're almost like fingerprints. Everybody has a different manifestation of their spider veins and something that we call reticular veins, which are just a bit bigger than the spider veins. So these injections are done, I think, in the best hands using magnification, which is the way that I do it, in a very, very tiny butterfly needle to inject very, very accurately and precisely and delicately all of those tiny little branches to fill them with this medication. Typically, again, today we don't use the hypertonic saline solution, the salt solution that many of you could remember from years ago. We have better medications now that are FDA approved for that purpose. Generally, again, various kinds of detergents, which are sort of a soap solution. And in the case of the little spider veins, we use a very, very low concentration because they're so little, we don't need a high concentration to close those veins, and then the body will absorb them. Typically, there'll be some bruising and discoloration for a number of weeks as the body fully heals and absorbs those. But the results are quite miraculous, really, really beautiful. And with that, not only does the patient look better, but almost invariably, they also feel better, because even those tiny veins can cause a lot of irritation in the skin, dermatitis, inflammation, itching, burning, etc. So that's a little bit about varicose veins. I think it's a good intro. We're going to talk a lot about all of the specifics of varicose veins and venous disease in upcoming videos, and I hope you'll join me for those. I have a lot to share, and who knows, maybe we'll bring some of my special friends who are guests onto the show with their experiences from around the United States and around the world in also taking care of patients with things like venous disease, varicose veins, lymphatic diseases, lymphatic problems, lipedema, wounds, all kinds of fascinating subjects related to the circulation and the vascular system. So thank you so much.